Hello, good evening. You're welcome to our presentation today. Today we'll be talking about prevention of maternal anemia. My name is Nina Ike-Ume and I'll be presenting to you this evening. What is maternal anemia? Maternal anemia or anemia is a condition in which blood has a lower than normal amount of red blood cells or hemoglobin. When this is applied in pregnancy, it is therefore termed as maternal anemia. Hence, anemia in pregnancy is a decrease in the total red blood cells or hemoglobin in the blood during pregnancy. What are the causes of maternal anemia? Basically, there are two types or two causes of maternal anemia, which is the iron deficiency anemia, approximately 75% of the time, and the folate deficiency megaloblastic anemia, which is a deficiency in folic acid. And these are more common in women who have inadequate diets or who are not receiving prenatal iron and folate supplements. What is the burden of maternal anemia? What is the prevalence in the world? The WHO, that's the World Health Organization, estimates that globally, 40% of pregnant women are anemic and 60% are in sub-Saharan Africa. So you can see is a huge burden on the system where 60% of pregnant women in this area are anemic. So what are the consequences of maternal anemia? Anemia in pregnancy has been associated with poor outcomes such as preterm delivery, low birth weight, and decreased iron available to the baby, which may lead to impaired development. Anemia may also result in impaired health in women and also low quality of life for them. As you can see in the illustration, iron deficiency anemia can lead to preterm delivery, premature delivery, and also low birth weight. I'd like to tell you a story about the benefits of preventing maternal anemia. It's a story of a lady called Ifia Opong, who was pregnant with her second child at 32 years old, and she lived in Tema Municipality, Community 25 to be precise. She registered and started attending antenatal clinic at 16 weeks. And at that time, her hemoglobin levels were okay. But then at the 20th week, her hemoglobin level dropped because she wasn't taking her prenatal vitamins, which included folic acid, and her diet was not good. Her antenatal nurses then advised her to increase her intake of green leafy vegetables, turkey berries, and citrus fruits. She was also advised to become diligent in taking her prenatal vitamins and folic acid. An iron supplement was also prescribed for her to take along with all this. Ifia took this advice very seriously. She improved her diet, which often included green leafy vegetables. She would use turkey berries and drink it twice a day. She also increased her intake of oranges and tangerines, which are rich in vitamin C. Ifia's hemoglobin level improved. During her delivery, although she experienced hemorrhage, she did not need blood transfusion because she had a high blood volume and a high hemoglobin level. She gave birth to a healthy baby with 3.3 kg and was strong enough to nurse her baby and continue her life. Now, how can we prevent maternal anemia? The first is to maintain a healthy, balanced diet. A healthy, balanced diet contains a lot of fruits, vegetables, and foods with calcium, protein, and whole grains. As we all know, this forms the 5 classes of food. We also avoid sugary foods and fatty foods, and also drink plenty of water. If you look at the first diagram here, you can see that the food have been segmented into 5 different classes. On this side, you have grains and all the carbohydrates that are healthy. Then you have the proteins, the fish, the chicken, the eggs. You have the dairy products, milk and cheese. You also have fruits and vegetables, which are healthy. And the second picture also shows us a mixture, like all the kinds of food that should be taken. And then we also see a pregnant woman drinking a lot of water. So you need a lot of water when you're pregnant. Secondly, consume a lot of turkey berries, green leafy vegetables, and citrus fruits. On the right, I have pictures of this, the turkey berries, the green leafy vegetables, and examples of citrus fruits. Turkey berries are rich in iron and can increase the production of red blood cells. Turkey berries, when taken with citrus fruits, can increase the absorption of iron. Green leafy vegetables have also been proven to contain many essential vitamins and minerals, including iron. So when you do this, you increase your hemoglobin level, thereby preventing maternal anemia. Thirdly, daily intake of folic acid and other prenatal vitamins. According to Nazir et al. In 2020, they said that iron and folic acid supplementation is a very feasible and cost-effective way to prevent and manage maternal anemia. The WHO has also recommended the daily intake of folic acid and iron supplements for the prevention of maternal anemia. Prenatal vitamins also include vitamin A and B12, which can reduce the risk of maternal anemia. If you look at the right, you see pictures or examples of the prenatal vitamins we have around. We have the pregnant care. We also have this other products that you can easily find in supermarkets. You have the picture of the folic acid that you can easily find in most pharmacy shops. And then a picture of a lady taking how to take her prenatal vitamins. So it's very important we do this daily to avoid maternal anemia. Fourthly, attending antenatal clinic regularly. This is very important because antenatal clinic attendance helps to identify potential complications and risk factors. It also screens for health conditions that can affect the mother and the fetus. Alongside, it provides health education. So when you attend antenatal clinic, some of these conditions can be picked early and managed early to avoid complications. You could also be educated about your health and things to do to have a healthy pregnancy. Therefore, it's very important to attend antenatal clinic regularly. I would like to summarize with a quote from Heidi Markov, who said, "Healthy bodies make healthy babies." We have nothing to lose. So as pregnant women, if we make our bodies healthy, our babies will be healthy. So if we do all this and prevent maternal anemia, definitely we'll have healthy babies. Thank you very much. You can follow us on Facebook, Instagram, and Twitter at Fight Maternal Anemia. You can also visit our website as shown and get more information about ways to prevent maternal anemia. Thank you very much for listening.